20 years of my life working in healthcare, working to care for Victorians, to make sure people have access to the healthcare that they need. And during that 20 years, by and large, the system has been fair and equitable. People, irrespective of how much money they earn, how much money they have in the bank, they can get their healthcare. But that is under threat now. I'd like to thank everyone for coming out today. I'd like to thank all the health professionals who turned out. Those people from the unions, those people whose family and friends go to GPs and community healthcare centres, and people who have turned out because they care enough about an equitable and non-discriminatory healthcare system to come out and actually have their say today. So thank you everyone for coming. What I want to say to Mr. Abbott today is hands off Medicare, hands off our Medicare system. This co-payments proposal is nothing but a continued push towards a user-paid system, and as the speakers before me have said very clearly, this is an ideology that works against the interests of healthcare and works against the poor and the most vulnerable in this society. The user pays and healthcare have no place being together. One is about community and one is about business. Healthcare should be about caring for one another because we live in a society together. That's what the system, Medicare, is built on. That's the premise, and that's the premise we need to keep in place moving forward. Yeah. So I say again, hands off Medicare, hands off our Medicare system, Mr. Abbott. And let's be clear, while $5 or $6 seems like an insignificant amount, we will absolutely see this number go up. As was said before, this is very much a thin edge of the wedge issue. This will increase, there's no doubt about that. This will be a push from the insurers. This co-payment will go through the roof, guaranteed. And this rally is just the start. It's going to be a long and protracted campaign. And so everyone here, it's really important that we get as educated as we can, that we encourage our family and friends and those around us to come out and have their say. So thanks very much, and hands off Medicare.